With rheumatoid arthritis, as we mentioned, it is more common in women, but men tend to have a severe form. As we talked about, the pain, the range of motion, so that they can get, you want to prevent scar tissue that causes them to lose range of motion and their joints can become more fused and deformed. Maintain or improve strength. Other comorbidities. It is an inflammatory disease, so other diseases that are associated with inflammation, like heart disease, are definitely important. And people can look to foods that tend to be more anti-inflammatory, like Mediterranean types of diets, whole grains, olive oils, fruits and vegetables, lean meats, and seafood. There are much better pharmacological treatments. We talked about those. These are maybe only about the 10-15 years. So people have much better options for treatment. These drugs do have some fairly serious side effects. So they're not without risk, but a lot of people do much, much better on these, thanks to these drugs than what they've done in the past. And they're not getting the joint deformities that they used to get. I have a friend that is a former grad school classmate who has rheumatoid arthritis, and he is a top level competitive bodybuilder. So he is still able to perform at elite levels, even despite rheumatoid arthritis. So, people are going to have flare-ups with rheumatoid arthritis. So they're going to have days where they're really not going to feel good. So, warm up and stretching. Strength training is really important. Once again, we talked about you don't want to lose those type 2 fibers. Isometrics if they really have pain. So this is a role where isometric exercise can really play a role. Isokinetic training, so that is doing the biodex type of movements that you can see in a physical therapy clinic or athletic training room. Most of us are probably not going to have access to an isokinetic machine such as a biodex. But aerobic exercise, so once again, you want to watch the joints. And you can there are special arthritis foundation classes, water classes. And if you are interested, you can get certified through the Arthritis Foundation to teach those classes. A lot of WISE and other types of community centers, especially senior centers, will have arthritis water classes. Let's move on to lower back pain. About 2/3 of adults will experience some sort of lower back pain that's not due to arthritis, osteoporosis, or fracture. Muscle, joint, disc-related pain. So your discs, if you look at the anatomy of the discs in the spine, they're like a jelly donut, or if you think about the type of gum that used to have the squirt in it. So it's exactly like that. So you've got the fluid that's in the center that moves around. And so that fluid can get pushed out, and the wall of the disc can be pushed out and press on the spinal column, and that can be pain. So that's your disc-related pain. Lots of times people will have a sudden move, they just move the wrong way. So many people I know that just, say I was taking the baby out of the car seat, or I was taking groceries out of the car. So, or it could be something that's a repetitive issue, especially in people in a workplace setting. And lower back pain, what's really important is overall core strength and fitness. So working on abdominal strength, not only the rectus abdominis, but the obliques, the erector spinae, so strength and flexibility. And a lot of back pain resolves on its own, but it may require treatment. And surgery is typically looked at as a last minute option.